Hello, this is Dr. Nessa Aghazadeh. I'm a third-year resident at the Department of Dermatology of Mayo Clinic, Rochester. And today I will be talking about skin and aging. I'll be sharing some strategies to help and support an aging skin. When we talk about aging of the skin, we are essentially talking about two different but actually related processes. One of the processes of aging is an internal aging, which essentially, and in simple words, means all of the physiologic and natural changes that happen as our bodies goes through the process of aging through years. So it is mainly governed by our genetics. It is a natural and normal process, and it happens all across the skin, meaning over our entire body surfaces. However, there's another process of aging that is called external aging. This is mainly the effect of the environmental or external factors on our body, and it's superimposed on the process of internal aging. We will be talking about some of the external factors that affect the skin, namely chronic sun exposure and smoking. So when we talk about the external aging, it is important to note that external aging shows its effect in the sun-exposed areas of the body. So mainly face, back of the hands, forearms, chest, back, leg, and the parts of the legs that are typically exposed to the sun. Sun in general is one of the most important contributors to the effects of aging. So what does sun do? Actually, the UV radiation from the sunlight, it attacks the entire integrity of the skin. It makes changes in the DNA of the cells of the skin. It also attacks the fibers of the skin, namely the elastic and collagen fibers that are the matrix that support our skin. And because of that, it makes the skin thin, lax, and it loses its elasticity over time. Not only that, but sun increases the risk of precancers and skin cancers, which we will be talking about in a few minutes. Smoking is also one of the external factors that contributes to the process of aging. So nicotine actually decreases the flow of blood to our different organs. And because of that, there is a deficiency of nutrients that go to the cells of our different parts of our body, in particular for our discussion, skin. There are also some chemicals that are toxic to the supporting fibers of the skin, namely collagen and elastin. And the heat from smoking itself can cause wrinkles. And also there is an increased risk of skin cancer in smokers as well as the cancer of other organs. So what are the signs of an aging skin? These are pretty straightforward as we naturally see them, but we'll go through them. So wrinkles, of course, are a sign of aging, which can vary from fine to deep wrinkles. The skin tends to get lax and saggy. The pigment of the skin or the color of the skin tends to get uneven with dark and light spots, increased freckles, and some benign growths of skin, namely a growth that we call seborrheic keratosis, or sometimes called wisdom spot. It is a very common growth that is kind of waxy and warty looking. It is benign and it's harmless, but it often increases in time with age. And sometimes it becomes a problem if it gets infected or inflamed or irritated, or some people just simply don't like the appearance. Otherwise, it is a nuisance or it's just a benign growth of the skin. The skin tends to get thin. It is very common for older individuals to have easy bruising. Some star-shaped white patches that look like scars, but actually scars without a preceding trauma tend to happen, especially in sun-exposed areas of the body. Healing is delayed in general, particularly of the wounds, and particularly of the wounds of the lower extremity, meaning on the legs and feet, which in general have a harder course of healing and a prolonged course of healing as is, but it also is even more so with older individuals. This is very important to know that as we age, the production of sebum, which is the natural oil of the skin, decreases. And therefore, the oil actually that covers the surface of our skin is is a sealing layer that protects our skin from losing its moisture or water. Now, with losing that sealing layer, what happens is we get a dry, flaky, and oftentimes cracky skin, which can lead to itching and inflammation and even eczema. This is more common even in the lower legs, and particularly in drier months of the year, in summer and in our climate in Minnesota. And another, of course, process of aging that is not a natural process, but definitely the risks of it are increased with advanced age, are the development of precancers and cancers of the skin, which we will be talking about. So there are some benign growths of the skin, as we discussed, as we get older. The picture on the left shows the keratosis that we were discussing. These are warty growths. They can vary in color from pink flesh color to mildly brown, darkly brown. They can be very small, from a few millimeters to very large. They often like the back, chest, and even face. And they can increase in number and time. They're usually benign. They do not cause any problem, and they do not turn into cancer. However, there are multiple reasons that we sometimes need to evaluate them. Sometimes they get stuck on clothing. They become irritating and inflamed, particularly if they're in the waistband or the bra line area. So some folks need to have them removed by their dermatologist or frozen, meaning treated with liquid nitrogen. Or sometimes they're unusual in the eye of the person because they are dark and they have appeared. So we are always happy to evaluate them as a dermatologist whenever there is a concern. But in general, these are very common and benign. Another growth of the skin that you can see is a benign growth on the face. It's actually enlargement of the oil glands, as we call them, sebaceous hyperplasia. These are yellowish, even orangish, small little bumps on the skin that are very common on the face. Now, talking about precancers and cancers, in this picture, you can actually see what we call precancer, or a sun damaged spot, and actinic keratosis. So this is not a cancer, but having many of these precancer spots, it actually increases the risk of getting future cancers. And it is actually a sign of chronic sun damage. Your dermatologist may choose to treat them because, like I said, they are associated with an increased risk of cancer in the course of the years. Now, what do they feel like? They're usually these scaly, gritty, rough spots that don't tend to go away. So, for example, you just seem to, be washing them, moisturizing them, but they just come back with that persistent scale. Particularly, they are seen in the sun damaged area. So if you have one of these scaly things that doesn't seem to go away, and it is red, it is gritty, it feels rough under your skin, that might be a precancer. You may, especially if you have many of those, you may want to have your dermatologist evaluate them and discuss options for treatment. Now, actual skin cancers, we will be talking a little bit more about them in a few minutes. You see a few examples of these in the slide. The one on the left is a squamous cell carcinoma. The one in the middle is a melanoma, and the one on the right is a basal cell cancer. We will be, like I said, talking about them in the next few slides. Now, what can we do? What strategies can we practically do to support an aging skin? This is important because these are everyday tips and tricks that you can do to help the physiologic changes that happen with the process of aging, and to support your skin as it goes through these processes. Like I said, one of the common complaints that we get in older individuals is dryness, that it can lead to a flaky, rough skin that can easily get inflamed and cause eczema. Now, what can we do for the dryness of the skin? In this slide, as you can see, we are focusing on the practices of showering and washing. So first of all, there are different thoughts as to what is a good frequency of washing your body. Some people prefer just a few times a week. Some people have to take a shower or bath every day. Actually, any of these strategies, as long as you prefer them, are okay. I do actually support everyday showers under these particular conditions so that it doesn't make the skin dry. One of the conditions that I want for the showers, particularly if they're daily, is that they have to be short, no longer than 5 minutes. And we would like our showers to be with non-hot water. So like lukewarm water is the best. So hot water can be damaging to the skin and even to the hair. The use of soaps really, in particularly individuals who have dry skin. Some people have very oily skin and they need to use soap as they need to, but people who have history of eczema, many of skin diseases such as atopic dermatitis or psoriasis, usually need to minimize the use of soaps. In general, I tell my patients that they only need to use soaps, in the folds of their body, underarms, in the groin area and genital, and in any other area that is dirty or soiled. Otherwise, really, you do not need to soap your entire skin every day. That is simply not needed. As to what kind of soap to use, I prefer a white soap, white bar soap that is not scented and has no fragrances. I prefer bar soaps to liquid soaps just because bar soaps tend to have less chemicals, because soap in its natural form comes in as a solid bar. And any process that changes a solid bar of soap into a liquid or a foam adds extra chemicals to it. And for a dry skin and sensitive skin, we really want to reduce any chemicals that come in contact with the skin so that we don't have an inflamed skin. For this reason, I prefer body soaps such as Dove or Vanicream. We don't want to name names in particular, but these are some suggestions. So any white, sensitive skin, non-scented bar soap should do. And I always prefer the same for washing the face and washing the hands as needed. You don't need to have different types of cleansers or different types of soaps for different areas of the body. Now, this is important. When the short shower is finished, you'll tap dry your body with a towel, and then immediately after or shortly after, you want to apply moisturizer. This is the best chance of your skin while it is, wet from the water to absorb the medications or the moisturizers that we put on them. If for any reasons you have a skin disease that requires treatment with a topical medication, a cream, an ointment, and steroid, this is the time really you want to apply it, because like I said, this is the best time as your skin is kind of wet and moist. It actually gets more absorbent. So you want to apply your medicated cream first if you have a skin disorder. And after that, you want to apply moisturizer to all of your body. If you don't have any skin disorder, well, perfect. Just apply moisturizer to all of your body. Humidifiers can definitely help, especially in, dry winters, such as we have in Minnesota. In all individuals, particularly in summer, and especially in people who may have changes in their body folds, I definitely recommend soft fabrics that can breathe, such as 100% cotton. And then, of course, I want to emphasize that we shouldn't skimp on hand washing, particularly at these times with the pandemic, because it definitely can remove harmful bacteria and viruses. But after any time of hand washing in individuals who have hand eczema or dry skin, we definitely want to recommend that you apply a moisturizer right after, as many times during the day as needed. Typically, I recommend at least once a day, and for people who have a disorder of the skin or excessively dry skin, 2 times a day application of moisturizers. Now, back to moisturizers. What kind of moisturizers should you use? I always recommend brands that are particularly for sensitive skin. It should be free of scent and perfume. So to speak, if anything smells good, it should not go on your skin, because it will cause, likely, particularly in individuals who have sensitive skin and have allergies of the skin, it can cause inflammation, and it can actually makes the dryness and itchiness of the skin worse. The best moisturizers are actually, unfortunately, the most gooey ones, which no one likes really. So the ointments, the ones that are really, really oily, are the best in terms of providing sealing environment on the skin so that the water is not evaporated. However, they're kind of messy and hard to apply. If I had to choose, I would actually often recommend Vaseline if an individual is, is just okay with using it. It's an excellent skin lubricant, but like we said, it can be messy. Other than that, I would recommend thicker creams, which provide better moisturization. And then lastly, lotions. But it is more important to apply something than, if you're more comfortable with lotions, that is okay. Just moisturize as often as you can do it. Now, back to the external factors that come that actually make the process of aging worse. One of the most important ones that we talked about, of course, is sun. So here I want to share some tips and tricks for being smart in the sun and enjoying the sun without damaging your skin. First off, you want to really seek shade when it is appropriate. So being outside between 10 a.m. and 2 p.m., you really may want to reconsider, try to stay either inside or in the shade, as the UV light is usually the most intense in these hours of the day, in particular, of course, in summer and spring. One of the most effective ways of protecting your skin from the sun is actually protective clothing. So physical protection from the sun, such as long sleeve shirts, pants, hats, and sunglasses. So this, I would say, is actually the main and the first way of protecting your skin. And then, of course, you want to apply sunscreen or sunblock to all of the areas of your skin that are not covered, or for example, your face and any other area that is exposed. But definitely start with physical protection and then go to sunblock. You have to be extra cautious when it's snowing near the water, ocean, of course, because the damaging rays of the sun can be reflected even more in those areas. So it's important to apply sunscreen even in the winter, because definitely the UV rays can be reflected from the snow. That's something that we sometimes forget because we don't think about it, that even in snowy days, they might be damaging lights. We do not recommend daily sun exposure to replenish the sources as a source of vitamin D in the body. The harms are probably greater than the benefits. So you want to make sure that you get vitamin D through a healthy diet. And for most individuals, actually, that will require supplementation of vitamin. And it's important to know that even like people who are not very diligent about sun protection are often deficient in vitamin D. So it appears that sun is not a great source of vitamin D, particularly these days with the changes in the environment and also the risks of being in the sun for skin cancer. So I would recommend a healthy diet and supplementation as needed. Now, talking about sunscreens, of course. So when you want to choose a sunscreen, first of all, you want to choose a sunscreen that says broad spectrum, meaning it protects your skin against both UVA and UVB types of sunlight. You want a sun protective factor, or SPF, of at least 30 or higher. If you especially go to the beach, of course, you want it to be water resistant. Just remember that most individuals, a casual use of sunscreen is usually 25 to 50% less what is recommended. So it is important that we apply really enough sunscreen, and most of us don't, just simply because how we casually use it. Cover all the skin that clothing is not going to cover. Usually the areas that we often forget are the top of the feet, neck, and particularly ears in men. Ears get really the burnt of the sun in older individuals, and also the bald areas of the scalp. So remember about those areas. Both protect them with a hat and apply sunscreen. You want to apply the sunscreen before you go outdoors, and then you will need to refresh it or put it on again every couple hours. So just because you have sunscreen in the morning, it does not protect you after 3 to 4 hours. So you want to reapply it if you continue to be in the sun or you have later exposure to the sun. So when you're going outside in the morning, if you're coming back, then you need more sunscreen. And then lips, we often forget about lips, but cancers of the lips do exist, and unfortunately, they tend to get aggressive so fast. So protect your lips with sunscreen that has SPF of 30 or higher. And there are lip balms that are on the market that do have SPF in them. Now, talking about skin cancer is important. It is the most common cancer in the human beings. And it's the most common cancer in the US, but they're highly, highly treatable, especially if they are diagnosed at an early stage. And that's why we emphasize so much on diagnosing early and knowing the signs of skin cancers and knowing when to go to your dermatologist. So we have two more common types of skin cancers, namely basal cell carcinoma and squamous cell carcinoma. So a basal cell carcinoma is essentially a very common skin-limited growth of the skin. It is very, very highly curable. It rarely ever, unless it is neglected and it becomes very deep and recurrent or very large, it rarely ever goes to any other organ. With squamous cell carcinoma, which is the second most common type of the skin cancer, it is still, when it is superficial and small, very treatable, very curable, in fact. However, this one has the potential of going into lymph nodes and other organs. So definitely, this is the type of cancer we want to catch early. The worst and fortunately, most rare type of skin cancer is a malignant melanoma, as you can see in the picture here. These are unfortunately the most aggressive and the most dangerous types of skin cancer. However, if we catch them there early, again, they're totally curable, but they do carry the risk of extending to other organs and spreading potentially. Now, what are the risk factors for skin cancers? Anyone essentially can get a skin cancer. So like I said, it's the most common cancer in human beings and in the US in general. But people who have lighter natural skin color, of course, they do lack the melanin or the pigment that would protect their skin. It's kind of like an built-in SPF, if you will. They lack it, so they have an increased risk of skin cancer. People who get suntan easily, who get sunburn easily and they blister in the sun, those are the ones that may end up having skin cancers in the future at a higher risk. People who have lighter eye colors, blue or green, blonde or particularly red hair individuals are at increased risk of skin cancers. People who have increased number of moles in general, and a certain type of moles that we call atypical moles, meaning they just don't look exactly typical, they're kind of a little bit off. These individuals, of course, have an increased risk of developing skin cancers in their lifetime. Family history of skin cancer, in particular melanoma, increases the risk of cancer for the first degree relative. And of course, people who have had skin cancer are at the highest risk of developing more. So once you've had your first skin cancer, you're essentially guaranteed to see your dermatologist at least once a year for the rest of your life, because once you get one, you can grow others. And of course, with aging, the risk of skin cancers increase. Now, what to look for if you want to be, diligent about your skin, and if you want to screen your body for skin cancers? Anything that is new, unusual to you, or changing should actually catch your attention. Not everything that is new growth is always cancer, but it should actually be something to look for. Any growth that increases in size and appears kind of pearly and transparent typically can be kind of basal cell carcinomas. Anything that is multicolored or has different colors in it, tan, brown, black, in different areas, this definitely should be evaluated. Any mole or birthmark or brown spot that increases in size, thickness, changes color, or is bigger than a pencil eraser needs to be evaluated by a dermatologist. And any spot, sore, any birthmark or mole that starts getting symptomatic, it starts getting bothersome to you. It itches, it hurts in particular, it crusts, it bleeds, it scabs. We want to know about it. And any sore, any wound that doesn't heal after 2 to 4 weeks, then we want to know about it also. Typically, any natural, the natural process of healing should work in about at least at the very last for 4 weeks. So anything that doesn't heal after a month could be a sign of skin cancer. Now, these are some tips, excuse me, for doing full body check. You want to examine your body back and front as much as you can do in the mirror. Don't forget about different areas of the body that are hard to see. Typically, these are elbows, forearms, back. You may want to use another mirror as you're standing in front of the mirror to check behind your neck and back, or even ask a spouse or a partner or a friend to check for you on a regular basis. Sometimes folks who have a lot of moles take pictures on their cell phones from their backs, or have their friends or partners or spouse take a picture, and they can regularly monitor any changes on their back. And sometimes we do that in office too. In a dermatologist's office, you may get a mole mapping, as we call it, or a full body, essentially medical image, which helps us kind of have a baseline of your moles and your skin growths, so that every time you come to us, we can check it. We don't always do that, but we do that in individuals who have many spots and are at increased risk of developing skin cancers. Now, this is the ABCDE rule of melanoma that you may have heard. So what you are looking for is asymmetry. So anything that is, this is of course a perfect symmetry, but this easily you can say that different types of different areas of this lesion are not symmetric. It's darker here, it's lighter here. It's also darker here, and in general, the overall appearance is not symmetric. Border, a regular, fine, and very well-defined border is, of course, usually typical of a benign lesion. But look at this border. It's ill-defined. I can barely say where it starts and where it ends. And it's very jaggedy, and it's really not symmetric border. Color. When a lesion has multiple different colors within it, that is something that we definitely want to look. So here you have tan, light brown, dark brown, medium brown, and all of these are concerning. Diameter, a lesion that starts to grow in size definitely catches a dermatologist's attention and should catch your eye as well. And evolution, any lesion that just is going through different things. It is getting thicker, it is getting bigger, it just is not stable. So we want to evaluate that as well for a potential sign of skin cancer. Now, some people may need to see a dermatologist on a regular basis. Now, the frequency of these visits may be, of course, different based on the risk factors and what your dermatologist thinks. But typically, people who have a personal history of skin cancer need frequent and regular dermatology visits. If it is a non-melanoma skin cancer, meaning basal cell carcinoma or squamous cell carcinoma, people often tend to be seen at least once a year. For melanomas, this tends to get even more frequent, sometimes as frequent as 3 to 6 months. So it all depends on your dermatologist, and you can, of course, check with them. People who have severely sun-damaged skin may also need regular dermatology checkups at least once a year. People who have family history of melanoma, again, we want to see them at least once a year. And people who, for any reason, have suppressed immune systems, for example, people who have organ transplants, or they have certain type of blood malignancies or blood cancers that decreases their immune system. So one of the things that our immune system fights on a daily basis are the cancerous changes in the cells. So when your immune system is weak, not only you are exposed to getting more infections, but you're also exposed to getting cancers. So organ transplant patients definitely need at least yearly skin checkups, and some types of lymphoma patients also need yearly checkups as well. Now, last but not least, I will be just talking briefly about some cosmetic procedures that can be done as a rejuvenation process. In general, any procedure that aims to, give a more natural and young looking appearance to a skin, we call it rejuvenating process. So for this process, many different applications have been used. Many of these are used by dermatologists and cosmetic dermatologists. One of the strategies is actually, because one of the things that happens with aging skin is that we lose volume, we lose fat, particularly in the face, in different areas. And that fat is what gives us that healthy, youthful appearance of the contours of the face. So sometimes people may actually choose to restore that loss of volume with fillers. Fillers are materials that are inert, that are safe to be put in the skin. They oftentimes are injected under the skin by a dermatologist. Again, this is important. If you want to get any of these procedures, or anyone you know wants to get any of these procedures, these have to be done by a certified, board-certified dermatologist, because there are a lot of, cosmetic procedures that are not regulated or safe out there. So that is one of the options. They're usually not permanent, so they go away after a few months, but they do restore some of the natural appearance of, for example, the cheeks, or under the eyes and the nasolabial fold, or the lower face and the chin area, when there is more so loss of volume and sagging of the skin. Botox, of course, is one of the most common procedures that is done in the United States. As you can see, Botox can, of course, reduce the frowning and deep furrows of the particularly upper face area. Brow lines, and also the little wrinkles around the eyes. However, it is important to note that Botox only works when the wrinkles are fine and superficial. When the wrinkles are too deep, usually Botox doesn't work. So what Botox is actually is a botulinum toxin. So essentially it is really a toxin that has been medically produced and weakened to kind of paralyze the muscles of the face in a very controlled and temporary fashion, so that we literally cannot, move those muscles in a way that causes wrinkles. So it is very helpful for dynamic wrinkles, meaning wrinkles that appear when we frown or when we move our eyebrows. But for static wrinkles, meaning the wrinkles that are there as we look at a person's face, it's less likely to work. Now, of course, we have lasers that attack or actually destroy the unwanted or extra blood vessels of the skin. That's one of the things that happen with process of aging, to get, extra blood vessels, particularly over the face or different areas of the body and even the legs. We have some vascular lasers that can safely and effectively remove the extra blood vessels. And as it goes, most of these procedures, unfortunately or fortunately, are not covered by insurance. So there's, of course, the cost associated with them to be considered as well. And finally, there are procedures that actually work on resurfacing of the skin, such as laser procedures. Essentially, the basic thought around these procedures are that if you produce a superficial wound, kind of like a very, very controlled and superficial burn on the skin, then the process of healing of the skin will rejuvenate itself. So the healing of the wound actually causes a more youthful appearance of the skin, a more fresh baby-like skin, if you will. And other than that, of course, there are plastic surgery procedures that can be done for more, advanced photo aging and skin aging, which are, of course, not the area of my specialty or the focus of my talk today. It was a pleasure doing this talk today, and please do not hesitate to contact me with any questions or concerns. I hope that this has been informative, and it has given you some tips and tricks for supporting the mature and aging skin. Thank you.